Vulvovaginitis and pelvic inflammatory disease, or PID, a case study by Angela Gulanes of grade 10 Quezon. Vulvovaginitis is a disease in which the vaginal area becomes inflamed and irritated. This can happen to girls of any age, although it is more common in girls who have not yet reached puberty. Vulvovaginitis is frequently caused by yeast infections, particularly Candida infections. Vulvovaginal candidiasis is another term for these infections. Yeast infections are not transmitted through sexual contact. Now, vulvovaginitis is a condition in which the vulva and vagina are inflamed or infected. It's a common problem that women and girls of all ages face. It can be caused by a number of factors. According to the Centers of Disease Control and Prevention, bacterial vulvovaginitis affects roughly 30% of women in the United States at some point in their lives. Because the vagina normally contains both bacteria, both healthy and unhealthy bacteria. Bacterial vaginosis, or BV, occurs when more unhealthy bacteria grows than healthy bacteria. BV may cause a thin gray vaginal discharge, pelvic pain, and a fishy odor. Now, what are the signs and symptoms? This includes redness of the vulva, vulvar and or vaginal itching, vaginal discharge or bleeding, stinging or burning sensations, and painful urination. What are the causes? Vulvovaginitis can be caused by a variety of factors. Because they have less estrogen, young girls are more susceptible because their vulvar skin is thinner and more sensitive. The common causes include allergic reactions, infections, which include bacterial, fungal, and pinworms, poor hygiene, and other skin conditions. How is it treated? In most cases, an interior examination is not required. A sample is performed by gently stroking the genitalia and vagina with a very little swab that is sent to the lab by the child's healthcare practitioner. If any specific bacteria or yeast grow, the lab will test it. Topical ointments and or an oral antibiotic may be provided if therapy is required. If the vulva is inflamed, red, or itching, petroleum jelly or diaper ointment can assist. Without treatment and a focus on self-care, the symptoms may improve. Symptoms might also improve during puberty. Now let's move on to pelvic inflammatory disease. What is pelvic inflammatory disease? It is an infection of the upper female reproductive system, which includes the uterus, fallopian tubes, and ovaries, or gonads. PID develops from a bacterial infection in the vagina or cervix, which causes inflammation of the mucosa. The mucosa is a layer of epithelial cells that lines inside of these organs. Untreated bacterial infections such as chlamydia and gonorrhea can cause PID, which means if naanak kay untreated bacterial infections like chlamydia and gonorrhea, you are most likely to get infected by this pelvic inflammatory disease, or PID. Let's talk about how common is PID. In the National Health and Nutrition Examination Survey in 2013 to 2014 cycle, the prevalence of a self-reported lifetime PID diagnosis was 4.4% among sexually experienced reproductive aged women, equating to 2.5 million prevalent PID cases in women aged 18 to 44 years old nationwide. So how do you know if you have PID? You may notice pain in your lower abdomen, fever, an unusual or an abnormal discharge with bad odor from your vagina, pain and or bleeding when you have intercourse, and burning sensation when you urinate or bleeding between periods. What do you do when you notice these symptoms? If you observe any of these symptoms, consult your doctor immediately. That is actually the most advisable thing to do if you ever feel any sort of abnormalities regarding your health and your body, may it be internal or external. If you suspect or your partner have been exposed to an STD, see a doctor right away. If you have any genital symptoms such as an unusual sore and stinky discharge, burning when peeing or bleeding between periods, visit a doctor right away. If you are sexually active and younger than 25, if you're younger than 25, get a chlamydia and gonorrhea test once a year. If you're sexually active, have an open and honest conversation with your doctor about whether you should be tested for other STDs. And also, if I may add, if you are sexually active, you should ask your partner about their sexual history and strongly advise them to also get tested to avoid further complications. Now, can PID be cured? Yes, it can be cured. PID can be treated if detected early enough. Treatment, on the other hand, will not undo any damage to your reproductive system that has already occurred. But the longer you wait to be treated, the more likely you are to have PID complications. It's possible that your symptoms will go away while you're on antibiotics, but the infection will not be treated. If your symptoms go away, you should finish your medication. Inform your recent partner so that they can be tested and treated for STDs as well. Because STDs are very common, especially for sexually active people. And if you're not open to that conversation with your partner, you are most likely to be the one who would spread it. And STDs are not a joke. They are some STDs are deadly and can be life threatening. It's also critical that both you and your partner finish your treatment before engaging in any sexual activity to avoid reinfecting others. That is all for my case study, ma'am.